My Firazyr, a step-by-step video guide to self-administration of Firazyr. Firazyr, icatibant, is indicated for symptomatic treatment of acute attacks of hereditary angioedema, HAE in adults with C1 esterase inhibitor deficiency. Important information. Always use this medicine exactly as your doctor has told you. This training on self-administration supplements instructions received from your doctor. If you experience no relief of symptoms 6 hours after taking Firazyr, you should seek medical advice regarding additional injections of Firazyr. A second injection of Firazyr can be administered after 6 hours. If necessary, a third injection of Firazyr can be administered after a further 6 hours. No more than 3 injections of Firazyr should be administered in a 24-hour period. If you are experiencing a laryngeal attack, that is, obstruction of the upper airway, you must seek medical care in a medical institution immediately after you self-inject Firazyr or your caregiver injects you with Firazyr. You must be trained in subcutaneous, under-the-skin injection technique before you self-inject Firazyr. Consult your doctor before taking Firazyr. If you are taking any other medicines, if you are suffering from angina, if you recently suffered a stroke, if you are pregnant or breastfeeding, think you may be pregnant, or are planning to have a baby. Read all of your patient information leaflet carefully before you start using this medicine because it contains important information for you. Wash your hands with soap and water before beginning the process. Open the blister by peeling back the seal. Remove the pre-filled syringe from the blister tray. Do not use this medicine if you notice that the syringe or needle packaging is damaged, or if there are any visible signs of deterioration, for example, if the solution is cloudy, if it has floating particles, or if the colour of the solution has changed. Remove the cap from the end of the pre-filled syringe by unscrewing the cap. Put down the pre-filled syringe after unscrewing the cap. Remove the needle cap from the blister. Remove the seal from the needle cap. The needle should be still in the needle cap. Grip the syringe firmly. Carefully attach the needle to the pre-filled syringe containing the colourless solution. Screw the pre-filled syringe on the needle still fixed in the needle cap. Remove the needle from the needle cap by pulling the syringe. Do not pull up on the plunger. The syringe is now ready for injection. Choose the injection site. The injection site should be a skin fold on your abdomen, approximately 5 to 10 centimetres, 2 to 4 inches below your navel on either side. This area should be at least 5 centimetres, 2 inches, away from any scars. Do not choose an area that is bruised, swollen, or painful. Clean the injection site with a rubbing alcohol pad and allow it to dry. Hold the syringe in one hand between 2 fingers with your thumb at the bottom of the plunger. Make sure that there is no air bubble in the syringe by pressing the plunger until the first drop appears on the tip of the needle. Hold the syringe at an angle between 45 and 90 degrees to the skin with the needle facing the skin. Keeping the syringe in one hand, use your other hand to gently hold a fold of skin between your thumb and fingers at the previously disinfected injection site. Hold the fold of skin, bring the syringe to the skin and quickly insert the needle into the skin fold. Slowly push the plunger of the syringe with a steady hand until all the fluid is injected into the skin and no liquid remains in the syringe. Press slowly so that this takes approximately 30 seconds. Release the skin fold and gently pull the needle out. Discard the syringe, needle and needle cap into the sharps container for throwing away waste that might hurt others if not handled properly. Almost all patients receiving Firazyr will experience a reaction at the site of the injection, such as skin irritation and swelling. These effects are usually mild and clear up without the need for any additional treatment. Other common side effects include feeling sick, headache, dizziness, fever, itching, rash, and redness of the skin. If you get any side effects, talk to your doctor. Tell your doctor immediately if you notice that the symptoms of your attack get worse after you received Firazyr. The information presented in this film is based on the Patient Information Leaflet, PIL, found inside your pack.